Hello, everybody. My name is Simon Mwangi, RN. Overall, I've been a nurse for 15 plus years, including my years as an LPN. My goal is becoming a psychiatric mental health nurse practitioner, as I have a huge passion with this population. For my education background, I graduated from Northern Essex Community College in 2013 with an associate degree in nursing. My nursing career, however, started in 2006 when I migrated to the US. My major before then, I was an accounting major, but when I came here, I got interest into nursing. I worked as a CNA to start off in a long-term care facility, and that was when I started going to for my LPN school and graduated from Greater Law Vocational High School in 2008. I then continued taking classes to add my RN slowly until my graduation in 2013. For my RN experience, I have a 2 year uh, experience working in a long-term care facility, but for the longest time where I spend most of my time is as a community nurse for 10 plus years working with the behavioral health population. I spent about a year working at the VA, about 2 years in patient psych, and about 2 years as an ACCS team nurse. ACCS was a job that I worked for a company called Vinfen. It's contracted by Department of Mental Health, where I used to oversee the medication administration program, which is commonly referred as MAP. Uh, I also used to assess patient during transition of care, post-hospital discharge, and as on an ongoing basis as needed. I also served as a nursing consultant to the team, as well as providing education to both staff and the patient. Currently, I'm working for an insurance company called Commonwealth Care Alliance, or commonly known as CCA. It's contracted by Mass Health and Medicare to manage their population. So we become the primary payer for these members. Um, I joined CCA in the year 2020, right after COVID hit. Well, but I did join as a case manager, or which is commonly referred there as a care partner, where I had a panel of patients. But then I transitioned to an assessment nurse, and currently I complete a minimum data set assessment, which is MDS, for our members. This entails the annual assessment for the population below 65 years of age, and twice a year assessment for the seniors, which are above 65. We ensure during this assessment, we ensure that members receive the support they need to be safe at home, and that they are receiving all the recommended preventive care from their providers, and making sure they are getting their recommended vaccines like flu shots, preventive measures like colonoscopies, pap smear, mammograms, etc. As I mentioned earlier, my goal is to become a psychiatric mental health nurse practitioner, as I have a great passion in this field. And as you saw earlier, that's where I've spent most of my nursing career. Um, the QI initiative involvement, while I was working for the agency that I worked for the community nursing, I did spend about 4 years as a QI nurse, and what I What I was involved is was reviewing field nurses' work to ensure Medicare standards were adhered to. I did a lot of reviewing of care plans to make sure that what the patient was referred to us for is what the nurses are doing out there. Also ensuring that the diagnosis matches with our care plan, plus, all the meds that have been prescribed in our system. I did also ensure that medrecs and appropriate follow-ups were done during, and after transition of care, which has become a big deal nowadays because we see a lot of communication breakdown there, and a lot of time something is missed, or some follow-ups are missed. So we did follow up with the nurses to ensure that all those things are happening. I also did review OASIS integrated assessment tool, which is the tool used in home care to assess patients out there. So it did review this after it came from the field to make sure that it was in alignment with our care plan and that it met the Medicare standards before we submitted it for reimbursement. Um, some area of improvement at my workplace. My job is hybrid in nature, meaning that I work sometime from home, another time I do go to do home visits. And so when you travel, our assignments remain the same. So sometimes you might find yourself driving a very long distance, maybe taking you about 40 minutes, which takes away your time takes away your time that you need very much to complete your job. So this increases nurses' anxiety related to their workload, and also when they would complete their work. So this is an area that can really get some improvement. The other area that I find needs a lot of improvement is many a times there is no cohesion between departments. Having worked as a case manager and now as an assessment nurse, I can tell that there remains a lot of, for lack of better words, some animosity between departments. You can tell there's a loud difference between these departments. Each department feels like it's the best in what they do, but unfortunately, they cannot avoid each other. And one problem from one department can easily flow to the next one. So finding a way to create cohesion is very important. My takeaway from this, from the reading, is from the Kenny book, from the page 31, where I found that, the author saying that driving out fear and building trust as one of the way of improving quality. This creates an environment where everybody is able to voice what might be going wrong, and instead of fearing that they might say something and get reprimanded for it. Uh, Again, reducing interdepartmental conflict. Uh, Also, another key thing, poor system leads to poor quality rather than poor workers. Many a times we think that because we don't have great workers, that's why mistakes happen, but most of the time it's because of system failure. And also that the best results are obtained when quality is built into the process rather than generating items and checking them, and that quality improvement is ongoing. And most of my reference came from the Kenny C book. Um, and I hope you enjoy listening to this, and I can't wait to hear more from everybody else. Thank you and have a great, all the best in this course.